Let's gonna move on to like what I thought might be interesting. Because the other day I got a consult. I was like, oh man, and so a consult, you know what that means, right? Somebody calls me and say, hey, we got a patient. So I was thinking what would be an interesting segment is talk about the worst plastic surgery consults.
Yeah.
So these are the plastic surgery consults that when you get it, have you seen that picture floating around the internet? From isn't that this Grey's Anatomy girl?
Yeah.
Yeah.
Despair.
So these are the plastic surgery consults that you never like to get. And I don't mean that in a bad way, because obviously we want to take care of patients, but there are some that are just hard.
Yeah.
Like they're difficult cases, maybe more prone to have problems. So you guys probably would know some of these. I don't know, maybe. I know we talked about this first one. So one of the ones that is definitely super challenging for plastic surgeons and can be very difficult is necrotizing fasciitis.
Yes.
Also known as the flesh-eating bacteria. And we've done a segment on that. Well, first off, it's very hard on the patients. It carries a 50% mortality rate.
Yeah.
People that survive have these massive, massive wounds because in order to save the life of the patient with the flesh-eating bacteria, you have to literally cut away their flesh. Like you have to cut out the infection.
Ugh.
And you have to like get ahead of it, and it spreads very rapidly. So oftentimes these people, that get this necrotizing fasciitis, in order to get them to survive, they end up with just these huge wounds. I mean, just massive.
And then they're in the hospital for
forever. A long time, yeah.
Yeah.
And so a lot of times I'll get consulted kind of in the middle. They'll say, oh, we have somebody with necrotizing fasciitis. We've debrided them once. We think we're ahead of the infection. Can you come in? And so, yeah, those can be a long road, and it's one of those things where there's really no right one answer. I mean, you may do one thing for one patient and do something completely different for the other. I've treated a lot of them over the years, and I say that they're the worst consults. I mean, I do enjoy getting those people well, but it's always generally a long road for them.
Yeah, uphill.
Yeah, it's definitely a tougher thing to do. And I had one lady that...
How do people usually get it?
So it's kind of random. I mean, people get random infections all the time, and so when people get infections that get down into that tissue plane along the fascia, the muscle, so like the layers of your body are like your skin, your fat, and then it's the muscle, but there's a layer of fascia on the muscle. And so that avascular layer is a place where bacteria can potentially spread very quickly. And so people get an infection and they either don't get it treated or it just moves very quickly and they start to get an overgrowth of bacteria along that fascia, and then it starts to basically kill the tissue. And it moves very, very fast. And it's kind of scary because you can just get it. I mean, we have bacteria all over us, right?
Yeah.
And so, I mean, you could be something simple as like I bump my hand and I get like a small crack in my skin and the bacteria get in, and for whatever reason my body doesn't take care of it, and then the bacteria get out of hand. Well,
one time I scratched my leg on like one of those center things at a Walmart.
Oh, man, at Walmart? Dude, I would have chopped my leg off.
No, I still have a scar. I have a huge scar on my leg from it.
Do you really?
Yeah.
I can fix that for you.
Okay.
I mean, if it's a bad scar, we can fix it.
It's pretty dark. I'll show you. It's on my leg. It's right there.
Yeah. I mean, if it's bad, it's something you can fix. But I don't know, man.
Scars all over
I would be very worried if I got injured at a Walmart. I just feel like the bacteria.
I didn't think anything of it. Like it was like one of those what are those things that they? It's like a crate. It was like the wood.
Oh, like a pallet?
Yeah.
Oh, man.
And it scratched my leg.
A Walmart pallet scratched your leg.
Yeah.
That's scary.
Everybody's like, that looks gross, Sarah. You need to get that checked out.
Did you get a tetanus shot?
No. I was just like, I'll put some antibiotic ointment on it and be good. Eventually
Next time you get hurt,
but...
call me. Do we know each other then?
No.
Oh, okay.
I mean, I don't know. Maybe.
I don't know, next time. All right, moving on. So that's definitely one of the harder plastic surgery consults. Definitely when you get a bad necrotizing fasciitis, you're like, oh man, I'm in for a journey.
But for the most part, if you're like, don't put yourself in like nasty, dirty situations. And
that's the thing about necrotizing fasciitis.
Clean for the most part.
Yeah, I mean, it definitely helps. Having good hygiene and taking care of wounds decreases your risk. But okay. I've seen people get it and they
are just like a normal person.
Yeah, they seem like a normal person.
That's not up to no good.
I will tell you that people that are heavier are more at risk, and diabetics are more at risk.
Okay.
So there are some risk factors for it, for sure. Okay, one of the other consults that really is not only just very difficult but very sad is we get consults for gunshot wounds to the face from failed suicide attempts.
Oh.
And so the most common way that that'll happen is like people will like put the gun like this and tilt their head up. And so when they tilt their head up and they shoot, like the bullet just destroys their face, but it doesn't like hit their brain. And so they survive it, but their face is just demolished.
Yeah.
And so, I mean, I can clearly remember several patients that I took care of that happened. And it is, I mean, aside from being just horribly tragic, it's so difficult because, you know, the structures of the face are very complex. You have, you know, bone, muscle, fascia, fat, skin, cartilage.
Yeah, cartilage. That's what I was
and
about
so when that stuff gets destroyed, I mean, you can sometimes put it back together, but it just is so complicated because you're having to oftentimes rebuild bone. You might have big areas of empty space that you have to fill, and of course at the same time you're trying to restore this to some sort of normal looking appearance. And I haven't treated one recently. There just was one in the hospital. I was talking to one of the other plastic surgeons in town because he was telling me about it. I haven't treated one recently, but man, I remember treating those back when I worked in the really big centers, and man, they are tough and definitely a consult that I prefer not to get.
Yeah.
This is one I do still get from time to time. Have you ever talked about spaghetti wrists?
No.
Okay.
No.
You have any idea what spaghetti wrist is?
No.
Okay. So this is also often from failed suicide attempts. So it's where somebody takes a knife and they cut their wrist across like that. And the reason they call it spaghetti wrist is because there are a lot of structures that run through the wrists that are cord-like, and when they get cut, it ends up looking like a mass of wires, because you got
That is vivid.
You got like 12 tendons that run through the wrist, because you got 3 that flex the wrist, you got 8 that run the fingers, you got some that do the thumb,
and then all the nerves.
Right, and then there's the nerves, right? There's 3 major nerve branches that run through the wrist, and then you got 2 major blood vessels. And so, I've seen people get 99% of it cutting, and you're looking in there, it's just everything's just all scattered, right? Because once they get cut, they don't just perfectly line up. They're all doing, and that's why they call it spaghetti wrist. And so you have to sit there and basically repiece everything back together. And it's very, very tedious because sewing blood vessels, sewing nerves, I mean, it's, for us that do that kind of thing, it's totally doable, but it's not fun. I mean, I personally don't find it fun.
Yeah.
It's very tedious, and then, you have to make sure everything lines up and then make sure the blood's flowing. And then it's just sad, right? Because another patient, harming themselves, those always kind of bum me out, to be honest.
Yeah.
I get those from time to time still. In fact, I had 2 consults for self-inflicted wrist injuries in the past month, but fortunately, neither one of them very bad. A lot of times when people start to cut, they get second thoughts and they don't get very far. All right, moving on. Neglected skin cancers. Oh, these ones can be rough. Have I ever brought any pictures in or cases from?
I don't remember. I don't think so.
Maybe not neglected, but I think you did bring in pictures of like melanoma.
Okay, melanoma. Yeah, we talked about melanoma.
Yeah.
So usually the neglected skin cancers are squamous cell, and just really briefly, not to get too boring with different types of cancers, melanoma can kill you very quickly. So generally, melanomas don't get really bad at the site, because once they get to a certain size, they spread, and then you have much worse problems. But squamous cell carcinoma, which is a very common type skin cancer, is very, very slow to spread throughout your body. But it is very destructive locally, and they can oftentimes be fast growing. So what happens is and you see this in people that oftentimes live in rural areas. They don't like to go to the doctor, and they get this growth and they just ignore it. And it just gets bigger and bigger and bigger.
Yeah.
And the problem is these things will grow right into bone. And at that point, when the cancer gets in the bone, things get really complicated because you have to remove that. And so I've seen some really bad ones. I was treating this guy for years that had one on his back, and it got into his shoulder blade. And we actually had to cut out part of his scapula, which is the shoulder blade. And he had just a massive wound back there. So we had to not only cut the bone, but then bring in muscle.
I think you showed pictures of how, I think you showed us that.
Oh, did we? Okay.
But it wasn't about, it wasn't like a subject of cancer. It was the subject of like
reconstruction or something?
Yes.
Oh,
it was how you moved muscles to different areas.
All right. Very good. Yeah, very good. And then I've seen a couple where it's on the face, and those are really hard because then it gets into the skull. And I actually had to send somebody down to UC Southwestern recently because they had one on their skull, and I'm like, look, I'm not taking your skull off. I mean, technically I could do that, but I'm out because we don't have neurosurgery on call and all that.
Yeah.
So yeah, those neglected skin cancers can be rough. And then the final one. So this is what we call tib fib. So this is your tibia, this bone, your shin bone, and then there's the fibula behind it. And when people get really bad lower extremity injuries, it oftentimes tears up the skin and the muscle, and the bone is basically right under your skin. And so when people get really bad tib fib injuries, it can be very challenging to get them clean, and orthopedics has to come in and try to fix the bone, and then we get called to try and cover everything up. Well, the problem with that location is there's not a lot of tissue down there that you can move around.
Yeah.
You know, there are a couple muscle flaps you can do, but most of the time you have to do what's called a free flap, where you go and you take muscle from one area and put it down there, and then you know, it's the location is bad because the blood flow in the lower extremities is way worse than it is, you know, closer to your trunk and your heart, and so they're more prone to problems. And I just have never been a fan of those. It's just, you know, it's just too much work.
Yeah.
I mean, everything doesn't have to be hard, but yeah, that's a rough one. So I don't know. I guess any other things you
Those
can
all
think of?
sound horrible.
Yeah, they are pretty rough. Yeah, I guess I could have brought some pictures in. I actually don't. The thing about it is I don't always have like permission to use pictures. You know, you have to get permission.
Well, you gave some pretty graphic descriptions.
Oh, you have like a
so.
picture in your mind?
Yes, I do.
But yeah, I mean, it's interesting. You know, it's like with being plastic surgeons, we do get some pretty wild consults, mostly for trying to fix big problems or big, you know, tissue loss.
Yeah.
I mean, it can be pretty interesting stuff, but some of them are hard. I mean, you know, there's sometimes you get a consult like, oh man, this patient's going to be with me forever.
Yeah.
It's going to take a long time to fix. Cosmetic stuff's much easier.
I'm surprised you didn't say anything about like burn victims or something.
Yeah, I guess burns, they are challenging. I always liked burn surgery though.
I guess it kind of reminds me of that, like the necrotizing thing that you're
similar.
talking about.
Yeah, they get
Except
really,
that
really
you don't
sick.
have to like, because you can get infections really easily with that.
Totally.
So it's like, it's hard.
Yeah, absolutely. I honestly though, I've always found treating burns to be satisfying. Really, really bad burns, so like a total burn, like a 90% burn, I mean, that does suck because those patients get super, super sick. And nowadays I wouldn't be treating their critical care stuff. I would just be treating the burn. In the old days when I was in general trauma surgery, we have to actually treat the burn and treat the patient with their you know, the critical care stuff. Nowadays I would just be treating the burn, which is not too bad. I kind of like skin grafting. To me, it's kind of satisfying. So yeah, I didn't even think about that one because I'm like, oh yeah, I kind of like doing burns.
Well,
I kind of miss it. I don't do.
Then it doesn't need to be on the list.
I only do like really easy burns these days because there's no burn unit at any of the hospitals I work at. I actually talked to one of the hospitals like, hey, you guys ever thought about having a burn unit? And they were like, no. Okay. Like, all right, never mind then. All right. Well, let me know what you think. If you have another thought about what might be bad plastic surgery, leave us a comment and I'll tell you what I think about it. But to me, those are some of the worst ones.